Hello, you're welcome to my platform. I am Dr.Sandra and I'm a surgeon. I help you become aware and sensitized about the different surgical conditions. Today's video is about the Scrum pox, also known as the Herpes Gladiatorum, also known as the Herpes Rugbiorum, and also known as the wrestler's herpes. The Scrum pox is a highly infectious, highly contagious skin condition that is caused by a given virus called the Herpes Simplex type 1. The Herpes Simplex virus type 1 enters into the body of the affected individual when it comes into contact with damaged mucous membrane or damaged skin, specifically the epidermis, the topmost layer of the skin. The Herpes Simplex virus type 1 can then enter into the cells of the damaged mucous membrane or the skin, specifically the epidermis, and they can start reproducing to form new viruses. When the Herpes Simplex virus type 1 enters into these cells and starts to reproduce, it destroys them. And this results into formation of some swellings on the skin called blisters. Blisters are swellings on the skin that contain clear fluid, and they measure up to 3 centimeters or more in size. After some time, the Herpes Simplex virus type 1 goes to the nerve cells of the body and it stays dormant. However, it can become active again if there are some triggers, for example, sun exposure, trauma to the body, a low immunity, or the individual is stressed, and it can now start to reproduce again. In the presence of these triggers, the Herpes Simplex virus type 1 will start to reproduce and form new viruses. However, if this occurs, the symptoms are less aggressive in comparison to the first episode. Scrum pox can be transmitted from one individual to another through skin-to-skin contact, even in the absence of skin lesions. This is because some individuals can be infected by the Herpes Simplex virus type 1 and will never at all present with skin lesions. However, these individuals can shed the virus onto their skin, and when you get into contact with their skin, you can get the Scrum pox, but they don't have the skin lesions. They don't actually have any symptoms, but they are having the Herpes Simplex virus type 1 on their skin. So when they get into contact with yours, they can actually infect you with the Herpes Simplex virus and you'll end up with Scrum pox. Scrum pox can as well be transmitted by direct contact with the skin lesions caused by the Herpes Simplex virus type 1. It can also be transmitted by direct contact with the infected secretions from the affected individual. For example, mucus or any discharge from the skin lesions or any body fluids. The spread is facilitated in the presence of a sore, but it can also occur in its absence. The virus can spread from the time of onset of the symptoms until the lesions heal completely. The incubation period, that is the period from exposure or contracting of the infection to the time of onset of symptoms, is usually between 3 days to 14 days. However, the virus can as well be transmitted in the absence of symptoms. This is very common between episodes. Remember that the individual gets the symptoms and there will be a time when they are going to be symptom-free. And during this time when they are symptom-free, they can as well transmit the infection, even when they don't have symptoms. The individuals that are commonly affected by the Scrum pox include individuals that participate in football, rugby, wrestling. This is because these sports tend to involve rubbing of skin, and if an individual has some skin lesions, they can easily rub their skin on another individual's skin and the lesions can burst open and the virus can easily infect the other individual's skin. However, Scrum pox can as well affect individuals with normal skin contact, where there is no aggressive skin contact, as in the contact sports like football, rugby, and wrestling. Scrum pox is also very common in individuals that participate in events where there is a lot of overcrowding. For example, musical concerts. The parts of the body that are commonly affected by the scrum pox include the head, especially the face. It also affects the neck, the extremities, for example, the upper and the lower limbs, as well as the chest and the abdomen. When it comes to the signs and symptoms of scrum pox, the affected individuals will first experience some symptoms at the area where the virus first got into contact with the skin. For example, tingling sensations, burning sensations, itching at that skin where the virus got into contact with the affected individual. After some time, there will be an eruption of a skin rash characterized by clusters of painful fluid-filled blisters. The blisters, by the way, contain very infectious virus particles called virions. After some time, the blisters will join and they'll burst open and they'll form a sore, an ulcer on the skin. There are also other associated symptoms, for example, headache, fevers, sore throat, and lymph node enlargement. These symptoms can go on for weeks and they are more pronounced if it is your first episode. However, the subsequent episodes are usually mild and less intense, but the affected individuals will as well get skin lesions. In the context of the recurrent, repeated episodes, the skin lesions usually form a scab just within 3 days. However, the skin lesions are still considered infectious up to 7 days of starting the antiviral agents. The skin lesions usually heal without leaving scars. However, some individuals might not develop any symptoms and they might not even develop any sores or rashes on their skin. But they will be carriers of the virus and they can easily transmit the virus to other individuals. In fact, majority of the patients that get exposed to the herpes simplex virus type 1 get infected, but only 10% of these individuals develop skin rashes or sores on their bodies. The sores usually appear 2 to 20 days after exposure to the infection, but they usually don't last longer than 10 days. The sores usually heal completely without leaving a scar, but the virus, the herpes simplex virus that caused the sores, usually stays latent or it stays inactive, dormant within the patient's body. This is why majority of the individuals get recurrences even after treatment. When it comes to the treatment of scrum pox, we usually employ antiviral agents, for example, famciclovir, acyclovir, and valacyclovir. Once the lesions heal, we employ suppression therapy. Suppression therapy is meant to prevent the episodes from reoccurring. It also helps the individual to not pass on the infection to other individuals, so it prevents the transmission of the herpes simplex virus. So we usually employ antiviral agents, for example, valacyclovir 1 gram once a day, or we employ acyclovir 400 milligrams twice a day. So the individual takes these medications for life, because once you're infected with the herpes simplex virus type 1, you are a carrier for life. By the way, the individuals that have the herpes simplex virus type 1 tend to get the episodes between 1 to 10 episodes in a year. So the suppression therapy is very important in making sure that these individuals continue to function normally in their day-to-day life. When it comes to the prevention of scrum pox, please exercise good personal hygiene. For example, if you're out there running your errands, there's a possibility that you can get into contact with other people's skin. So it is important that you come home and shower immediately. This can reduce the possibility of you getting scrum pox. Please also avoid overcrowded settings. And if you must attend overcrowded events, please make sure that you wear clothing that protect your skin. For example, the long-sleeved clothing. Rigorous screening should also be exercised to exclude individuals that have suspicious skin lesions from participating in contact sports, for example, wrestling, rugby, and football. I also recommend that we start a practice of screening individuals that are attending overcrowded events, for example, musical events, because these type of events entail individuals coming into contact with one another's skin. So it is easy for individuals to contract herpes simplex virus in these events. When a skin examination is done before practice or competition, it can help identify individuals that need further evaluation or treatment. Individuals that participate in contact sports, for example, rugby, football, wrestling, should be put on antiviral agents during the time they are training or during the competition. In fact, medication should be started 5 days before the competition or the training. That is what I had for you. Thank you so much for watching and listening. Please share my videos and also subscribe. See you in my next video. Bye.